Sir, what are the most exciting advancements in radiation oncology right now in 2025?
That's a very good question. So if you remember my previous answer, I was talking about proton beam therapy and particle beam therapy. So in 2025, we are nowadays talking about particle beam therapy, which includes proton and carbon ion both. There was a time when neutron beam therapy was also in use, but nowadays it is mostly practically out of use. So the utility and use of proton is gradually increasing. But the bad thing about it is it's a very costly technology. The treatment is also very, very costly, and majority of the patients in this country are unable to afford the cost. It is, as of now, not widely available. It's not even available in every city of the country. It's hardly available at one or two places. Carbon ion therapy, as I was telling you, is available only at few very developed part of the world. We do not even have a carbon ion facility. A very innovative way of delivering radiation which is happening is known as flash therapy. It's as of now under research, but the very preliminary clinical usage have shown very good result. So flash therapy is basically delivering an extremely high dose of radiation in a fraction of a second, just like a flash of light. And that's like a single shot treatment. So the patient does not even need multiple radiation sessions. However, please remember that this is not a routinely used treatment as of now. Many centers in the world are doing a lot of research on use of flash therapy for different types of cancer. They are successful in providing cure to few cancers like skin cancers. That's very safe to treat. So these are the exciting developments in terms of radiation in 2025.
So, sir, how is artificial intelligence being integrated into radiation treatment with planning and delivery?
Again, a very interesting question, and thanks for asking this. We as a radiation oncology community are using artificial intelligence for a long time. If you are aware that we work in front of computer, we have our software. Just like the surgeon operates inside operation theater, we plan our treatment sitting in front of the radiation software, and we manually delineate our treatment area, the tumor, and then we manually delineate each and every surrounding healthy normal organs. And then we create the radiation plan, like from which angle the radiation will be delivered, what kind of dose do we need to do, and then whether the surrounding normal healthy cells are adequately spared from the bad effect of radiation or not. So this entire thing is known as radiation planning. Now you'll be surprised to know that our radiation oncology software, they are all equipped with AI facility for a long time. So many of these centers are now using AI-driven software to delineate the organs, to delineate the tumor. Of course, it is done with the supervision by some trained radiation oncologist, whether the job done by the AI is correct or not. There are some machines which are also AI enabled. They give us very good idea about change in tumor shape and size during the course of a radiation. Many a times our radiation continues over the weeks, like 5 weeks or 7 weeks. And many a times it happens that the tumor is changing its size or shape. Many a times it happens that the surrounding organ is changing its size and shape. Many a times the surrounding organs can keep on moving. Like when we treat prostate cancer, the rectum lies behind the prostate gland. It can change its shape and size depending on amount of fecal content inside it or the amount of gas inside it. So nowadays there are systems which detect this change, and quickly they create a new plan while the patient is inside the machine without wasting a lot of time. So these are all new developments, and definitely AI is helping us a lot. AI also helps us in diagnostic part, and radiation oncology is basically nowadays hugely dependent on diagnostic radiology also.
So my next question was based on that only.
So we use CT scan, we use MRI, we use PET CT scan for our treatment planning. And definitely we all know now that AI has a big role in those diagnostics also.
So, sir, how important is early detection and what role does awareness play in improving cancer outcomes, especially through AI?
It's a very, very good question. You will be surprised to know that in our country, 60% of the total cancer burden are caused by either bad lifestyle like tobacco chewing, like alcohol consumption, pan masala, gutka use, all these things. So these are all lifestyle related problems, habit forming drugs. And second one is caused by some kind of infection, like in women we see cervical cancer. 95% of these cancers are because of one infection known as human papillomavirus infection. Breast cancer is again the commonest cancer in women in our country in metro cities nowadays. It has surpassed cervical cancer now. Although in rural areas we still see cervical cancer as the leading cancer in women, but in metro cities breast cancer is leading. Lung cancer is again one of the commonest cancer in the entire world. It's not only the commonest cancer, it's one of the commonest cancer to cause maximum death in the world. Now, the AI has actually changed a lot in terms of diagnostic capacity. You probably are aware that mammography is a very commonly used diagnostic tool to diagnose breast cancer at early stage. And it's very fascinating to know that AI are detecting the breast tumors at a very small size, which is literally not possible by a human eye. A very recent report is actually showing that the AI can detect even 1 millimeter cancer or 2 millimeter size cancer by some machine. There is a very newly developed AI enabled PET scanner which can detect even 1 millimeter tumor. The AI enabled mammograms now are detecting the possibility of some abnormality inside breast being converted to a cancer down the time. There are AI-enabled softwares which can also predict an abnormality inside lung progressing to a cancer. So AI is definitely changing the diagnostic landscape. That means we can detect a cancer even when it is actually not possible to diagnose by a human being. So that's changing the entire landscape of cancer diagnosis. And then definitely when we can diagnose the tumor at such an early stage, the possibility of remaining cured definitely increases. As I said, a stage 1 cancer can have a possibility of 90% or 95% cure for many cancers. And it can reduce to 60% when it is stage 3. That means if we detect the cancer by using AI at early stage, we are automatically increasing the survival. Now coming to awareness, this is possible only when the general population is aware about the risk of developing cancer and when they seek precautionary measures like doing timely mammogram or doing timely screening tests, taking proper vaccination to reduce the risk of cancer. Again, it's very interesting that cervical cancer, which is caused by human papillomavirus, you can reduce the risk by 95% just by simple vaccination. Human papillomavirus vaccine is nowadays available and it's mostly recommended for the school-going girls. If you vaccinate them at timely manner, then probably they will never have this cancer in their life. That means you are protecting them from one of the deadly cancers. Of course, that comes with awareness. Breast cancer, again, awareness is the key to success, the key to cure. Diagnosing breast cancer at stage 1 is only possible when the woman goes to have a regular annual mammogram. So, of course, AI technology is helping us, but it's only awareness which will lead to have this success.
So, sir, do you believe India is making enough progress in improving quality cancer care, and do you believe that India is making improvement in terms of awareness also?
A very difficult question to answer, I would say. India is definitely making a huge progress in terms of quality care. The unfortunate part is it's not available everywhere. So we have a lot of heterogeneity. We have a lot of heterogeneity in terms of available healthcare and infrastructure facilities. We have a lot of heterogeneity in terms of quality of training across the country. So there is a lacune in terms of available technology, available infrastructure, availability of trained manpower and personnel. And I believe that with government initiatives, spending more funds on health and healthcare, particularly on preventive aspects, on awareness, and of course, not ignoring the treatment part. So, a scope for treatment, a scope for early diagnosis, a scope for awareness definitely will make the situation better. There is no technology which is not available in India at present. That's a fantastic thing. Whatever is available in developed part of the world, we also have the similar technology. We talk about robot, it is available in India. We talk about the latest radiation technology, it is available in India. We talk about trained manpower, it is available in India. We talk about research, it's happening in India. We talk about the latest molecule like immunotherapy, targeted therapy, everything is available in India. But if we talk about availability, yes, not available everywhere.
The advancement is there, but the availability is not.
And secondly, if we talk about affordability, many of these fancy treatments or most advanced form of treatments come with a cost because the technology is costly. So affordability is also a factor. Not everyone is able to afford even when the technology is available next to their home or their place. So availability and affordability are not uniform. So that is why we need to work.
So sir, any final message you would like to leave our listeners with regarding cancer prevention, support or hope?
Yes. Having a cancer does not make the life hopeless. There is always a ray of hope. The key to have that ray of hope is early diagnosis, early and proper treatment. Early and proper treatment is possible only when the population is aware. General people have that awareness that we should not ignore our symptoms. It's a very common problem in our country that people keep on ignoring their symptoms. Even doctors keep on ignoring the symptoms, even when the things are very obvious. So do not ignore the symptoms which are obvious. Do not think that my problem is not because of cancer. Rather than that, keep on thinking that every symptom can be attributed to a cancer. We need to diagnose. Maybe if we investigate 100 patients, we will be able to diagnose 2 or 3 cancer patients. But then the life of these 2 or 3 people will change forever when we detect them early, we treat them early and properly, versus we do not detect them and we don't treat them early. And please know that most of the cancers are now curable. Regarding the support, there are a lot of support groups in terms of providing mental support, psychological support, financial support, and also to guide the patients what to do. There are n number of patient support group nowadays where the patients themselves act as a guide to other patients by sharing their own journey. And believe me, that inspires a lot. And we as a medical community are always there to help you, to help the patients, because at the end, our motto is to be with everyone. So with this, I want to end that don't lose the ray of hope. Come to your healthcare services on time.
Thank you, sir. Thank you for sharing your valuable time with us.
Thank you so much.
That was Dr. Mondal for us. Thank you, viewers. Keep watching and stay tuned for the upcoming episodes. Thank you.